absolutely fascinating. That was a piece of history which a team here in Gibraltar and a team at the London Clinic achieved. And because today we have the technology to deliver such care to patients, and we have the telecommunications links, because mind you, London Clinic is 2,400 kilometers away from St. Bernard's Hospital. But the technology is such that you feel you're only 60 milliseconds away. So it feels like you're in the same room as you would be if the patient was in London. Fascinating way of humanitizing surgery today and making this available to the patients in Gibraltar.
So the technology allows precision beyond what perhaps human hands can do, but do you also lack the immediacy of being in here in person? What are the pros and cons of this kind of surgery for you? Or is it all pros?
I think it's mainly pros. The cons are what happens if the technology fails. Now, that hasn't happened as yet, but could potentially happen. The way we mitigated it is sent a team from the London Clinic, my assistant who came over here, so that if, God forbid, something happened, then there were people from my team here who could complete the operation. But otherwise, it is like being in the same room as the patient. Distance is not an issue because the robotic technology has tiny little wrists. It has 3D HD vision, which is magnified many times, and the communication between the vision and the wrists is ultra fine and ultra sensitive. So you can communicate with the vision and with the wrists from a distance and translate those movements inside the patient. So a much finer and much more precise operation, less blood loss, less pain for the patient, shorter hospital stay, and quicker recovery.
And how many of this type of surgery has been carried out so far, and what are the plans for more of these surgeries in future? Is there plans to expand the scope of what can be offered?
Yes, indeed. We have done 3 of these procedures now between the London Clinic and St. Bernard's in Gibraltar. They were all robotic radical prostatectomies. Let me make that simple. These patients had prostate cancer, which was within the prostate gland, hadn't spread anywhere. So we cured these men by removing their prostates by keyhole surgery through 6 small holes in their tummies. The plan now is to do another operation, again a robotic radical prostatectomy, in September. This will be transmitted live to a European Congress of thousands of people who will be attending and learning from the experience. And then there are plans to expand this into gynaecology, so for women, and also into bowel surgery. So I think this will be good for Gibraltar patients. They don't travel, their families don't travel, and guess what? We save the environment because we reduce the carbon footprint.
And you mentioned that this is being used as a teaching opportunity as well. So what does this mean for the field of urology, a field of surgery more generally, and how is it sort of taking off?
So one of the issues as surgery becomes more AI-driven, more technology-driven, is the problem with teaching this to other surgeons. People go through training programs, what we call curricula, to learn in a structured fashion. And with telesurgery, today comes telementoring. So the surgeon in Gibraltar, for example, no longer has to travel at vast expense to another part of the world just to learn an operation. We would be able to mentor them across distances. So an expert surgeon can mentor a less experienced surgeon to perform that operation safely and do so to a point where they become competent and do so for their patients. So I think this has vast potential. This has already been done elsewhere where an expert has mentored a more junior surgeon, and it has worked very well for patients. So patient safety is the key to all this, and I think with telesurgery that is what we are bringing to patients.